This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Together.
Let's keep you safe.
A lot of people think about killing themselves, adults and kids.
Most of them never try it, but some of them do. So if your kid says,
I'd be better off dead. I can't live with this.
I'm gonna kill myself,
Take her seriously. Find someone she can talk to about it, someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure.
But sometimes it goes deeper, and it's not going to go away by itself.
Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
but don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts.
Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe. If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask. Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut.
Because it never hurts to ask.
And it can make a big difference.
All the difference. In your kid's life.
Good evening, ladies and gentlemen. Welcome to Philippines Uncut. I'm your host, Buddy Kunana. Now, on this show, we talk about everything in the sun, and tonight is a very interesting topic in discussion. We're going to talk about suicide, which is a very touchy and sensitive issue, and we're going to talk about a play that opened 2 days ago called Suicide Inc. that is principally aimed at raising awareness of suicide and depression. Now, joining us to talk about this fascinating topic, sensitive topic, is Dr. Ronaldo Alepaño, and he is a consultation liaison psychiatrist. Doc?
Good evening.
Good evening. Welcome to Philippines Uncut.
Yes.
Yeah, it's a pleasure to have you here, Dr. Alepaño, because, you know, as I mentioned in my opening spiel, this is really a sensitive topic, and, you know, it's something that a lot of people would not like to think about, talk about, discuss openly, and that's what we're doing here in Philippines Uncut. We're bringing this out in the open so we can really clear the air and talk about the issues, and what best way to do it than with people like you.
Yes.
Okay. Let's talk about your background, Doc. What is your medical background when it comes to this field?
I graduated FEU from a medical school. I did my training in psychiatry in Medical City. I did also my subspecial training in consultation liaison psychiatry in Medical City. For those who are watching what consultation liaison psychiatry is, it's actually what they call psychosomatic medicine or medical-based psychiatry. We deal with a lot of people who have medical illness that has psychiatric comorbidities, because medical illness and psychiatric illness somewhat coincide and vice versa.
What do you mean by medical illness? Like people with undergoing...
Those who have cancer, those who have diabetes, those who had a heart attack, those who had stroke. Most of these patients somewhat exhibit psychiatric manifestations, or sometimes the psychiatric manifestations come out later.
How do these, I mean, just a little bit off topic, how do these two intersect? Let's say, I mean, medical condition and the psychiatric condition.
Because there are certain medical conditions that can actually present as psychiatric disorders, or the medical condition itself
can trigger
a psychiatric condition. Best example there is if you have a stroke.
Okay.
Certain parts of the brain that actually has a stroke can actually present with depression.
Really?
So
How
that's something that we actually, you know, treat.
Is this a new field?
It's not as new as one may think. It's actually old. It's just had a lot of revisions in terms of the way it was perceived. It was initially called psychosomatic medicine, then they presented it with consultation liaison psychiatry, then went back to psychosomatic. So they still couldn't decide. But it's gaining popularity nowadays, especially in tertiary hospitals where we deal with a lot of medically ill patients. It's actually good because we have partnerships with different hospital units.
Yes.
The dialysis unit, for instance, the HIV clinic, for instance. So the psychiatrist is very much involved.
And I think, part of the healing process in general of a person would involve, a big part would be, the attitude, the mental attitude, no?
Yes.
This is a big factor, I think, no?
Yes.
Okay. Now, let's jump into the topic. Let's talk about mental illness. Let's talk about depression. First, let's define what is mental illness.
Well, mental illness generally is any condition that you can be defined in the Diagnostic Statistical Manual of Psychiatric Disorders. So it's what you call a psychiatric disorder, no? So it can range from a normal reaction to a psychological stressor to a more, common mainstream type of illness such as depression or schizophrenia, for instance. So that is the spectrum of mental illness. But it's, for us psychiatrists, it's something that we actually help people deal with and something that we can actually treat.
Yes, and mental illness is, why is it often misunderstood or there's very little awareness really of mental illness in the Philippines, more so compared to other countries in the West, for instance. And why is there like a general misunderstanding or lack of awareness on this topic?
We have to understand that there is also a cultural nature to it. We are expected to be happy people. I mean, you have seen the statistic of Filipinos or the tagline that the Philippines is the happiest place also. So there is that misconception that we are not allowed to actually be sad. The other parts of it is universally there are such stigma towards having mental illness. Why? Because it's something that is poorly understood. Even until now, with all the researches, the less we know, the more afraid we are of it. So that's where the stigma comes from.
Yeah, and it's poo-pooed by a lot of people. But, maybe the mental illness is not recognized, and they dismiss it as bad attitude, maybe, or something like that.
It's sometimes a taboo topic. Let's not talk about it. There's no need to go to a doctor about emotions. It's always assumed that you don't air out your dirty laundry. It's a family thing. Let's not talk about it. And of course, from our culture, we try to fix everything within the family. But nowadays, there is actually a paradigm shift. I mean, there is a light at the end of the tunnel. Nowadays, we see the younger generation more open to it. Of course, our Western counterparts have been at it for quite some time already. They have a better acceptance of mental health, or I would prefer mental health rather than mental illness.
Yeah.
So they have a better acceptance of mental health and well-being.
How is the mental health area? How developed is it in the medical industry, like in your field? I mean, are there many mental health practitioners?
Not a lot, actually. At the moment, I think there's almost just 1,000 of us.
That's small.
1,000 to 1,500 versus the whole population.
Yes.
You have to understand that as a psychiatrist, you can only see so many patients in a day versus the number of population afflicted with mental illness. So there is actually what we call a mental health gap, which World Health Organization has actually identified.
Yeah.
So one of the advocacies of mental health professionals is actually to train those who doesn't have mental health training to treat those who have mental disorders or mental illness.
That's a nice advocacy, like a force multiplier, so to speak. So it is possible for you guys to do this, to train lay people, so to speak, but who have the skills to address it.
We actually train general practitioners or nurse specialists to actually train, to actually treat those who have mental illness.
Interesting. Kind of like a first aid, like a first emergency type situation.
Depends on the type of illness. Like depression, for instance, is treatable in primary care. We expect a general practitioner to be able to detect and treat successfully a depressed patient.
I'm glad you threw that word out because I want to jump into the topic depression, which is a big word, and it's a word that is misunderstood again by many and taken lightly, erroneously taken lightly by not a few. No, let's define depression.
Well, depression is actually a mental state, a mental feeling of emotion wherein you have low self-esteem, you have low mood, you have other symptoms accompanying it, such as difficulty of sleeping, poor appetite, and all the other things that accompanies having low mood. This is somewhat different from what we call the sadness. We also feel low mood and sadness.
Those things, as I want to say, yeah.
That's what I've mentioned. But how do you differentiate it? I mean, I think the biggest question here is, when do you say that you need to go to a doctor when you're sad?
Exactly.
Right? I think the best way for you to know when to go to a doctor is when you're unable to fulfill your duties and responsibilities as a person. If you are a student, you don't go to school anymore because you're so sad. If you're a working person, a yuppie, for instance, a young professional, you don't go to work.
Yeah.
If you're married, you're unable to fulfill your, father duties, motherly duties, and all the other things.
So, to make a long story short, I mean, it's reached that point. Your sadness has reached that point where it's affected your ability to function
Yes.
as a human being. That's when that is one of the red flags, basically.
Yes. Universally, if you talk to psychiatrists from other countries, because there's also cultural variance, you expect certain cultures to actually act this way. For instance, there is death in the family.
Yeah.
There is that cultural variance. But when we had a meeting of the minds between different psychiatrists from different cultures, we have actually come to terms with the fact that the biggest common factor there to say that you need to go to the doctor is when you have functional decline or functional disability.
Good. I mean, that's an excellent way to put it. Functional disability, inability to operate as a ordinary, normal human being.
Yes.
Now, it's strange though, because this word depressed. People use it so casually these days. I'm depressed. I'm not doing well at work. Blah blah blah. And that is part of the reason why maybe a lot of people don't take this too seriously. It's become a word that people throw out there so easily, so casually. No? Would you say so, Doc?
Yeah. I think because you can't argue also of the influence also of mainstream media, It's been sensationalized, and I think it became part of the pop culture, There are certain subcultures here also wherein being sad is cool.
Yeah.
So that's something that we also have to deal with in clinical practice.
Yeah.
But I always say that once you find yourself in a situation where you when you say yes to any of these two questions, go to a doctor. First is, feel depressed most of the time. You feel sad. You find yourself having crying spells for more than 2 weeks.
Wow.
And because of this sadness, the second question is, do you find yourself not being motivated to do anything? You don't have any desire to do anything. Things that usually make you happy when you're sad doesn't work for you anymore.
It sucked the meaning out of life.
Yeah, exactly.
Kind of like that,
If that persists for more than 2 weeks, go see a doctor.
Okay, let's link now depression to suicide. Because a lot of the case of suicide, I would say great majority, really stem from depression.
Yes.
Is that correct?
Yes.
Yeah.
Suicide is not actually a medical condition. It's not actually a mental illness per se. It's actually a symptom of a disease or an illness,
Yes.
like depression, for instance. Suicide actually has been correlated with a number of mental disorders or mental illnesses, and 80% of these disorders that has suicide as a side effect is actually depression. So when you say you have suicidal thoughts, attempts, desire to actually commit suicide, most likely 80% you might have depression. So it's important for us to actually know where the suicidal thought is coming from.
Why is depression a natural, let's say, starting point for something like suicide, an awful thing like suicide?
Well, you have to understand that one of the thoughts that, or the symptoms that come or stem from suicide is that there's no hope. You don't see any light at the end of the tunnel. And you feel that the only escape from all this is actually committing suicide. And they feel that if you talk to a depressed person and then you tell them, why want to commit suicide? And you ask them, why do you want to commit suicide? They feel that it's an escape. It's a better option for them.
Okay, yes.
It's better than feeling this way.
Yeah, yeah.
That is the burden of depression.
In the Philippines, so let's say generally, I mean, there are warning signs, right? People who commit suicide do say things that people should take notice of. And what are these warning signs that other people looking from the outside, looking in, should be aware of?
I guess that's a very difficult question to answer because there's no one sign that will actually 100% predict that this person will commit suicide. But I always say, whenever somebody verbalizes suicide, that's the time you actually take notice, bring them to the emergency room. That is one of the few emergencies of psychiatrists.
Really?
Which is suicide.
This is a psychiatric, a mental health.
We call it a psychiatric emergency.
Psychiatric emergency. So when someone says, I want to kill myself, and exhibits signs of depression, those things
the
you
mere
said.
fact that they said it.
The mere fact they said it.
It's already a warning sign. You have to bring them to the hospital. But this also has to, one of the things that because you have been here, one of the things that I also like to say is that for those who are listening, to not use the word, I want to commit suicide, as a, fashion statement or something that you usually use willy-nilly without consequence. I think the way we have the bomb threat law, we should also have that suicide threat law. People shouldn't say that I want to commit suicide so lightly and use it as a means to act cool.
Do you see it happening? I mean, in
I see
mainstream
it, of
pop
course,
culture and things like
you
that?
see it also in
Yeah.
pop culture. I
Yeah.
said there is a subculture that likes to feel sad, that likes to cut themselves, but they're not necessarily suicidal. So, but there is also a subculture there especially when you've seen suicide glamorized so much in mainstream media that people think that, oh, if I commit suicide, I'd be cool.
Yeah.
But the problem with that is that sometimes the threat itself might not be real, but they accidentally kill themselves in the process. So like, I'm going to jump in the window, and then they slip, and then they fall.
Yeah, yeah, wow. And then, what baffles a lot of people about suicide is because, for instance, there have been recent cases of, very well-known people who've committed suicide, and, lay people would ask themselves, now, why did this guy kill himself? He's rich, he's famous, he's popular, he's got everything. And why is that? How come sometimes it's the most, even the people who you least expect to commit suicide are those who do it?
I think the best way to answer that is that the truth of depression and suicide is that nobody's exempted from it, There's no preference in terms of sex or gender, age, race, even social status doesn't exempt you from feeling depressed or being afflicted with depression and having suicidal thoughts.
Yes, yes.
There are certain populations that will actually make you think that they're more at risk. What are these subpopulation? The very young and then the very old are more at risk to complete suicide. If you have a pre-existing mental condition, such as depression, bipolar disorder, schizophrenia, if you actually have medical conditions compounding the depressive symptoms, it actually worsens, it increases your risk for suicide. If you actually take illicit drugs, alcohol, it lowers your capacity to control yourself. Your impulsivity becomes higher, hence you commit the likelihood of you committing suicide is higher.
Yes, yes.
And if you have very low social support.
Yeah, interesting you said social support. In the Philippines, you know, we know that family here is very tight-knit. You know, I mean, there's always a relative, you know, a call away or a few kilometers away. Now, I understand in the West, for instance, in the U.S. or you know, more developed countries where people tend to live farther apart and things like that, and there's less interaction with families. I understand that statistics are higher than here. Is that true, or it could be just a case of misreporting?
You have to understand what statistics actually mean. If you look at statistics, it's also based on surveillance, how well the surveillance or the monitoring is. So if, for instance, US has a good surveillance system, everything is reported, everything goes through the system, then you have a better bird's eye view of what the real statistic is. But if you look at the general statistic, why the World Health Organization's last statistic for suicide was in 2012, the average suicide rate for US is 11%, 11 per 100,000 population, versus in the Philippines it's 2.9 per 100,000. You can easily misinterpret it and say, oh, the Philippines has low suicide rates, but they only look at the deaths by virtue of suicide.
Yeah.
You only look at those that are reported. Because, I mean, you have to understand, in our culture, there's still a certain level of taboo. There's already taboo from a depressed standpoint, more so if you have suicide.
Yes, even just recognizing the problem is already taboo. Like you know, a lot of families would say, you know, it's just attitude. You know, I mean, just cheer up, right? I mean, you keep hearing people say that to people who are depressed. Cheer up, or look on the bright side of things. Try to think positive, right? These are the catchphrases that people use. Now, when we're dealing with clinical depression or you know, mental health, mental illness, this is not enough. It's not enough to just tell the person, think positive. You know, take a chill pill.
It's easier said than done, especially if you're not in that situation. You know, just go through your own personal experience of being sad. Anything will tell you, anybody would tell you, will actually lift your mood.
True.
Because you're in that lowest point in your life.
True. Doc, before we sign off for our first segment and then talk about the play, let's talk about what is your advice to parents or viewers watching now who may know people in this situation, who have kids maybe, or siblings or loved ones in this situation. What is your advice to them?
First is that depression is treatable. So don't be afraid to go to a doctor and actually seek help. The earlier you treat the illness, the better the treatment. Meaning the prognosis is better. The risk of it being worse is lower. That's why don't be afraid to seek help. There is a number of us, maybe not as much as one may think, but you will always find help available to you.
Is there some sort of network available for people like this? I mean, in the States, it's very developed, you know, this suicide network and things like that. But is there anything in the Philippines like
You
this?
can actually go to the Philippine Psychiatric Association website. You know, just Google Philippine Psychiatric Association, and you can see a listing of doctors around you. So that's something that they've actually it's been there for quite some time. There are other services like MD Consult where they can actually connect you to doctors near you. But I think the best way to get in touch with the doctor is go to Philippine Psychiatric Association and look for doctors near your area because they have a registry there.
Yes, and as you said, depression is treatable. You can get cured of depression.
Yes.
In your practice, how do you, is it a combination of a pharmaceutical approach and counseling? How do you do it?
Okay. There's actually 3 ways to actually treat depression. One is by doing therapy. You know, that's the talk therapy. The other one is by medications. So these alone are sufficient enough to help. But I think the best way is the combination. And at the end of the day, I leave it up to the patient. But sometimes if I feel that therapy alone will not work, I will insist that they need to be put on medications because the medications are actually effective. The downside sometimes with talk therapy is that it takes forever to work. It's not economically sound, you know, especially if you're paying for your, psychiatrists are not HMO, you know, connected because there's no HMO that will actually cover us. So it's really an out-of-pocket service. You know, you can go to the government hospitals, but of course you still have to pay for medications if you need to take medications. So I think if it's a approach which is talk therapy and medications, the outcome is somewhat better.
Very good. Doc, we have to pause for a break, but when we come back, we're going to be talking to Mako Alonso and Francis Matthew, who are part of the display, which is opened 2 nights ago, called Suicide Inc. Very interesting topic again. And so guys, stick around because more of suicide and depression when Philippines Uncut returns.